Guys, welcome back to Medical Coding with Blue. Today's episode is all about advice to new to the medical coding industry job seekers. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So I saw this post on LinkedIn, and this is somebody that's new to the industry. And I said, okay, well, let me do a video about this because these are the questions that a lot of new people will ask in like direct messages. When I get direct messages like this, I don't answer because the channel is so full of shows about advice and things like that. So I just don't have time to address every single one of those, and there's so many of them. If you have the time and you can look up my email address, you can certainly look through those videos. So here we go. So the post reads, I've been informed many times to apply to all jobs, whether I possess the required skills or not. My question here is, how are we supposed to get through the automated questions on Indeed that immediately reject your application due to answering 0 on a question the employer has listed in the application process? All feedback is deeply appreciated. So the thing that I would say about this is, when you are applying, Indeed is not the only place that you can apply for jobs. Indeed is not the only place that you can go to apply for jobs in coding. I always recommend to go directly to the website for that hospital, for that organization that you want to work for, and fill out an application online for them, right? Because that's what everybody does, right? But if you happen to get one of these questions of, how much experience do you have, and you say 0, and then it automatically gives you that rejection letter. It's not an automatic rejection. This is just the system sorting resumes and sorting candidates. And so what happens is you go into another pile that says these people don't have experience, but they applied. Okay, so the employer knows how many people did apply. Well, guess what happens when there's happy coders in the area? They're going to stay where they are, right? And so they're going to have to look at all the candidates that have applied, and if they're desperate enough, and sometimes they are, okay? And so sometimes it's not unusual to hear, well, I got that immediate rejection, and then all of a sudden they call me back like 3 months later because they said, hey, are you still interested in this job? Can you come in for an interview? And so in that case, that's how you know that it goes to a separate pile. It doesn't go away. It goes to a separate pile because they have to keep these statistics going, right? So they know that they made an effort to get somebody in there. So you go and, they put you into this process of, applying months later. And so then you either get it or you don't. Well, again, you have to still keep applying. But if you get that automatic rejection because you answered 0, maybe you go to the organization website and you look under their careers tab and you apply directly to the organization themselves, and they give you that dreaded rejection, then what you're going to do is you're going to physically mail a copy of your resume and your cover letter. Okay? Now, hopefully y'all have listened to me when I have said that you need to have your resume on one page. It does not matter what you have done in the past. It needs to be condensed down to one page. No one has time to read 3 or 4 or 5 pages on the resumes. No one, okay? If you follow any of those HR folks on Instagram, they will tell you that employers will look at your resume for maybe 5 or 10 seconds to see what it looks like. Is it something that's going to grab my attention? So if they have to sit here and flip pages, oh, no, ma'am, no, sir. No, ma'am, no, sir. Now, I am a resume writer myself. My rate and contact information is in the description box below. But what I will say is this. I have done 2-page resumes that have just gotten as much callbacks. But as time goes on, I say to myself, well, it looks cleaner on one page. And so now I just do one-page resumes because everything can be condensed down to one page, okay? You only have to go back 10 or 15 years. You do not go back further than that. Do not go back further than that, because when they're running a background check on you, that's as far back as they're going to run, 10 or 15 years, okay? So that's just something that you got to know there. But with that said, you are going to physically mail a copy of your resume and your cover letter to that organization. You can put it attention to HR. A lot of times they'll put, who's doing the hiring, the contact person, and things like that. Then you can say this is for that job listing, and then you can put the job listing number if you saw it or whatever information you can put. Maybe even print out a copy of that as well and attach it to your resume and cover letter. And you could say, please forward to the hiring manager. You could put that in the envelope, right? And in the front of the envelope, you could put, attention HR department or whoever specifically, and then that way you can just mail it there. Now, I do recommend getting a manila envelope. Don't fold it, okay? A manila envelope is best. If you need help addressing an envelope, there's lots of videos on YouTube. You can also Google that as well. The only reason, don't get your feelings hurt and don't tell me, oh, you're condescending. No, I'm not. They don't teach the children in the school anymore about addressing envelopes. They don't even teach them how to do cursive handwriting, which is a travesty to me, and that is horrible to do because children should be doing cursive handwriting. I'm just saying that's a whole another topic, and I get very upset about that. But with that said, there's a lot of these things that get missed out in the school, right? Addressing an envelope, unfortunately, is one of them, okay? You can Google how to address an envelope. You can also, I'm sure, watch a video on YouTube about it, all right? But send in a copy. Okay, so here's the thing. Now, there's no guarantee that this is going to get you extra brownie points. However, it shows that you went above and beyond. That yes, okay, you did get that automatic rejection. But in this, and in your cover letter, you could say, I did apply through your website as per the request online, but I wanted to follow up with a copy of my resume for your review. Now, if I see this, I'm like, oh my goodness, this person really wants this job. And they're showing initiative that they're not just going to take no for an answer. Okay? This is something that you can do if you want to. If you don't want to, don't listen to me. What does it matter? Right? But I'm giving you advice that I think would be helpful for you. Again, there's no guarantee that it's going to get anybody's attention. However, mailing it is going to go to somebody. It is going to go to somebody, and somebody is going to see it because it's mail, right? And it's gonna guarantee. There we go. It's gonna guarantee that it's gonna get to somebody. Now, don't go to the hospital or the organization and drop off your resume because then it will get lost. With the mail, this has to go to somebody and somebody has to sort through it, okay? So that's why you want to mail it in. You don't want to take it in because if you take it in, somebody can just throw it in the trash, or this doesn't matter, or we're not looking, or whatever, or this person really showed up. Don't do that. Don't do that. You mail it in, okay? So that way it has to go through their mail. They have to sort it. It has to go to somebody. And then when you look at, okay, well, this person wanted to apply for this job. Okay, well, it's a little different, but we have to open the envelope. So we're looking at it. Okay, well, oh, this resume looks nice. Oh, this person has all the skills that we need. Oh, okay, well, they were rejected by the system. Oh, well, they were rejected by the system. That's all right. We haven't had any applicants. Let's go ahead and give them a call. Hey, we got your resume. Again, it's not a guarantee that would happen, but let's think outside the box, folks. Let's think outside the box, because when you get so like, I only can apply on Indeed, I can only apply online, and it automatically rejects me, and then you get so upset. Rather than that, let's think of another way. There's other ways of doing things. Let's talk about when it was 2020 and nobody could get in anywhere to visit anybody. Okay. I love this story. And of course, during 2020, everybody's emotional, but I remember listening to this story and I had tears in my eyes because it was so beautiful. This lady, her husband was in an assisted living facility, right? And so every day she would go, before 2020, every day she would go and she would visit him and things like that. And so, and of course that's what kept him going, And then, of course, 2020 hits and no one can get in anywhere to visit at all. And they said only employees can come in here and visit or can be around the patients. And so this lady says, well, if they're not going to let me come in and see my husband, well, then I'm going to get a job here. So she got a job as a dishwasher just so that she could be an employee of that assisted living center and be able to go and see her husband. She didn't take no for an answer. She didn't get beside herself and say, oh, I can't go see my husband. I can't go give him a hug. I can do something else to get in there. If it is that they only allow employees in there, what can I do? I can wash dishes, certainly. And so she applied as a dishwasher, got in, and she was able to give her husband a hug because she made a way. And it's the same thing that you got to do when you're searching for your first job as a medical coder, because there's a lot of these job ads that say, oh, you must have 3 to 5 years experience. That's the default. Okay, that is the default that you will see in a lot of these job listings is must have 3 to 5 years experience, right? And sometimes they say credentials on there that don't even exist anymore. And sometimes they even say, oh, candidate must know ICD-9. Again, if it says the candidate must know ICD-9, no one on the planet uses ICD-9. By September 2015 was when it when ICD-9 ended. Okay. So if you see ICD-9 in a job ad, you know that that's just the default. And these are HR people putting these ads out, okay? Sometimes it's not the actual coder or the health information staff that's putting it out. It's somebody from HR. And so if it's somebody from HR, they don't know what we do. They have an idea about what we do and an idea about the credentials that we need. But sometimes it's not always the most up-to-date thing, because they're HR and they have so many other professions that they're dealing with, okay? So don't always see that, okay, well, just because they ask for this, they ask for this, they ask for this, I don't have this, I don't have that. Stop self-rejecting. Stop self-rejecting, because that's a problem that we see. As soon as we see something that we don't fit that, okay, well, I can't apply for that. When in actuality, you can. What is the worst that could happen if you apply for a place that asks for 3 to 5 years experience? You don't get a call. You're already not getting a call by not applying, right? So if you say, okay, well, I'm going to go ahead and apply for this job anyway. Well, guess what? You may just actually get a call. You know what? We need people. This person had enough moxie to go ahead and apply. This other person had enough moxie to send in their resume. So let's go ahead and give them a call, because this is somebody who's clearly thinking outside the box. Okay. And getting into medical coding doesn't require you to work for free. It does not require you to work for free. And a lot of times people get hung up on that too. Well, I can't get an internship and I can't volunteer, blah, 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 because the organizations still have to protect HIPAA, right? And that's what we do. We work with protected health information. And do you think that somebody's going to allow somebody to come in willy-nilly and just be able to look at all these things and volunteer as a coder? No, unless there's an agreement in place, and that's usually involved with the schools, right? But even then, sometimes you may not even be exposed to the electronic health record. You may not be exposed to coding at all, because again, they still have to protect that private information. Right? So if you're looking for an internship or you're looking to volunteer, you're wasting your time and your money, because you had to pay, either you had to pay for the school or you had to pay with time to be in the school. You know, and then heaven forbid, if you got a student loan to go to a school for medical coding, you have to pay that back. You don't need to be volunteering. We have a skill that is trained. So because we have a skill that is trained, we have to work for money. We don't have to work for free. There's a lot of people that get hung up on that too. Oh, well, just to say that I have experience. You know, this lady was saying that, you know, she had volunteered And she had worked it out with the employer as far as like, oh, she was going to code for them and things like that. And then they were going to hire her on, and that was the whole thing. And I guess she had an agreement and thing like that, protect HIPAA and things like that. So, but he never wanted to hire her. Why? Because she was working for free. So why should he have to hire her? It doesn't make any sense. He's getting more money coming in, and she's willing to work for free because she's thinking that she needs to put in all this time. And she was with him for a couple of years doing that for free, and he never hired her. And she's running around so lost and confused, not knowing what to do. You worked for free. You gave away your skill for free in an industry that makes millions of dollars, billions in some cases, per year. You should not be working for free. You should not be working in positions that are not going to give you additional experience. I've talked about this on the channel before. Prior authorizations, working in charge entry. That's also another way to get yourself exposure to the codes. Working in medical billing. That's another way to get yourself exposure to codes. So that way you can get familiar with them. You can get familiar with the policies and everything. You can get familiar with the electronic health record before you step into that coding role. So even though you can't get a job maybe right away as a coder, but you can still try these other positions that will still give you exposure to the codes and that will still pay you. But if you're sitting here saying, oh, well, I want to work at a front desk, I want to be a secretary just so that I could get exposure to the codes. Oh, but they said if I work as a secretary, they're going to let me code so that way I can learn to do the coding. So that you're going to do two hats. You're going to wear two hats. You're going to give away your technical skill for free. And not only that, you're going to be a secretary. A secretary that is difficult because you have to work with the patients. Sometimes the patients are confused. Sometimes they need things explained. If they really like you in that position, that's where you're going to stay. You are not going to move to a coder position. And before any of you argues with me, it is the truth. If an organization sees that somebody is really good at something, it is a very special organization that will move that person on to a better position. But in other organizations, they say, we can't do without this person to be here at our front desk because the patients love this person and they do so fantastically at it. When they go on leave, everything, just falls apart. We can't lose this person, and they will keep you there. I had a lady who commented that was true, that it happened to her, and that she had spent years there, until she finally had enough. And she said, you know what, I got to move on. So she had to move on and start over at a whole new organization because they would not let her move forward in that organization. Not her supervisor, not anybody from HR. The HR would not help her. So she had to move on to another organization. And all the years that she lost because she was really good at her job. But she had to leave in order for her to be able to move on and do better things and to be able to use her coding skills. And that's the other thing too. The further away you get from the time that you graduated or you got your certification, the further away you get from that time that you're not actually doing coding, because I know a lot of you will stop. Y'all won't even study anymore. Y'all won't even look at these books because you don't need to. You think you don't need to. Rather than keep up with your skill, you'll leave it all behind, and then all of a sudden it's a year and a half later, you haven't touched your books, and now you've forgotten everything. So all that money that you spent trying to be a coder, all the time you spent trying to be a coder, you're still not a coder a year and a half later because you stopped studying. You are trying to apply, but now you don't know what you're doing because you've forgotten everything because you stopped studying, right? And then you don't know what to do now. Instead of just listening when I tell y'all. Prior authorizations, charge entry, medical billing. Any one of these alternative positions. You can also apply for a claims reviewer. Claims reviewers working on the insurance side. The insurance side, that means that you are getting the claims from the doctor's office. You're looking at the claims, you're running it through an encoder, you're running it through the software to see if there's any edits. Edits are saying that this condition can't go with this one, or there's something wrong here, or needs a modifier or something. And then you're the one who's saying, okay, denied. And then you send it back to the insurance company, the doctor's office with the code and things like that of like why it was denied and that kind of thing. And then you do that, you process those things. So again, that's good exposure for the coding side, right? Because you're exposed to the codes and you're working in something that you can apply your skill. Only work in positions that are going to apply your skill. I can't believe how many people are just so cavalier about that. Like, oh, well, I can just do secretary and it's not even going to apply your skill. I can do patient access. Again, not applying your skill. These are very important positions. Absolutely. There is no doubt about that. Hospitals would not be able to run without these people, you know. But these are positions that, especially like with patient access, these are not technically trained where you have to have a certification, all these kinds of things. You have to go to school for it. These are not technically trained positions. And so because of that, you know, the expectations for those folks are going to be a lot different. And you have the skill. So stop being so scared of the skill and practice more. Even when you pass your certification exam, okay? Still continue to practice. You don't have to be practicing as heavy, but you still need to practice, okay? And if you need a meantime in between time job, get a meantime in between time job, but don't make it something that you think, oh, patient access or medical secretary or something like that, or where they're doing patient appointments and things like that, because those positions are going to burn you out. And not only that, it's not going to give you, again, if you're really good at that position, they're not going to want you to move. And it's going to be real easy to get stuck in that position. So I would recommend that if you need a job in the meantime, in between time, that you do something that is unrelated. So that can keep you motivated to be able to continue to look for a job in coding. The reason that I say this is because when I was looking for a job in coding, I was still working as a bartender. I worked at a halfway house. I worked at, I did houses. I cleaned houses and things like that. So doing all of these things, I'm on my feet all day. I'm physically exhausted because these are manual labor jobs and these are very difficult. You know, you work in a bar and you are you are listening to people talk to you all kinds of crazy ways. You work as a housekeeper and you got people treating you all kinds of different ways, crazy ways. They think they can treat you and they can't, but they do. And so again, these are jobs that I took just to keep money on the table. I mean, keep food on the table for myself and to try to keep myself going and to be able to pay for my vehicle and things like that. Because again, going through a divorce and going through all these things and moving and just having to do all of these things, you have to do what you have to do to survive. But it still kept me motivated to continue to look for a job in coding. And so going to the temp agency, when my mom suggested I go back to the school, and I went to the temp agency after the principal from the school said, I have a friend who has a temp agency for medical professionals. You can Google that yourself. Temporary agency for medical professionals, not medical coders, for medical professionals. You will see a lot of them pop up in your area. And get your resume on file with them. They may not have anything right now, but a lot of times these temp agencies will also compete for coding contracts. And they just need people to be filling those seats a lot of times. So that's just something that you can have out there as another option of getting you in to the coding field that you have been training for. Okay, that's all I'm going to say. I'm going to leave it at that. They have more on their resume, but they have more on their post, but I'm going to leave that for another episode. So with that said, that's my advice today anyway, guys. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.